So I'm Henderson McGinnis. As Jay said, so you have all been officially invited to be a presenter at the 12th Annual Southeastern Wilderness Medicine Conference. So it will be either in Roanoke or in Winston-Salem, North Carolina next year. So everyone here has some experience that you can share with the medical students. It's primarily geared towards medical students. So this is a free plug. This is extra. You won't see this on the syllabus. So, but this is your first invitation. So this is your first step to, for the medical students, it's a nice little bullet on your CV, something you can talk about during your interviews. Just if you do put it on your CV, make sure that you've done it. Okay, and make sure that you know the people that actually did it, because it's kind of embarrassing for someone to say that they volunteered at one of my events that I don't know. It has happened. It's pretty fun. It's fun to be on the other side of the desk when that happens, not on the opposite side of the desk. But we're going to talk a little bit about wilderness medicine curriculum. So what is it? What's the curriculum? Yeah, exactly. It's crickets, okay? So basically, it's kind of how you design the structured learning environment that you want. So that's going to vary for each of us, right? When you look at the programs we have here, all the faculty, we're all at different programs. We all have different strengths and different weaknesses. And our students have come in with different skill sets. The coolest part about wilderness medicine is that you can do it anywhere, anytime. It's truly emergency medicine and emergency medicine, right? Because you've got all the things that you may never, ever, ever see without any of the resources that you want. So it's kind of like, oh, it's really like TV, except the people are much hotter. So you get to say, hey, we're really good at doing Himalayan research. We're really good at doing altitude research. Man, I'm in North Carolina. We do not have mountains. We have flavalanches. We don't have avalanches, okay? So what are we going to do? We do a lot of whitewater paddling. We do a lot of outdoor things like that. But we have designed a curriculum for, what are the basic things in wilderness medicine? And actually, Walt, you can talk to Walt. He just published an article about this. Kind of a curriculum for a longitudinal course during residency. There's also the longitudinal course during medical school, and there's fellowships. So what do you need to cover? What is the sort of breadth of knowledge you need to be wilderness medicine trained, right? And that's out there when you look at it compared to the breadth of knowledge you need for emergency medicine. Fortunately, we are not board certified, for a board of wilderness medicine, so you don't have to spend an extra $2,000 and take another set of boards, because that's super painful. And when you think about it, wilderness medicine is something different to everyone. We have folks who only go up on mountains. We have folks who only dive. We have folks who only hang out in the desert. They're not going to go anywhere else, right? It's kind of like the North and the South, Jews and Catholics. I mean, sometimes you just can't get people in the same room, right? So it's okay to laugh. I try not to offend anyone, but I'm sure I do, and I apologize. But no, you have to think about, what do you need out of wilderness medicine? Maybe you came in with a really strong set of wilderness skills, and you're working through medical school, like some of us did. We had a significant outdoor background, and we were like, hey, I like doing this. How can I incorporate this into my medical practice? So you want to look at how you can structure that, as opposed to someone who comes in with a ton of medical skills and no wilderness skills. So, you'll see this a lot in disaster relief. People are like, I want to go help, I want to help, I want to help. But they can't survive outside of the Four Seasons. It's true, okay? You will see, when you look at disaster responses, a lot of the aid workers become disasters themselves. And so you have to be able to take care of yourself. So thinking about including that in your wilderness training, in your curriculum. Like, what do I need to do to be able to function in the environment I want to go out and recreate in, right? Because you want to be safe when you go out there. So to me, that's the number one part of a curriculum, is designing an experience so that you can gain the skills that you need to function in the environment where you want to go play. And then do your wilderness medicine. Because it's really, when we talk about wilderness medicine, we're actually talking about just being outside or being somewhere fun, doing something fun, hoping that nothing ever happens. It's kind of like a shift in the ER. You're like, oh, this is awesome. Get to prop my feet up, hang out, and then it's the, oh no, bad things happen. So, but you're ready for it. You're ready for those things. So when you think about designing your own curriculum, for the students, there's a lot of stuff out there. For the folks who are faculty, talk with me. We can talk about how you can implement these things. Getting the students to say, hey, this is what we want. We've been doing a lunch lectures for our first and second year students, and they've now said, hey, we want to do this for the incoming medical students. So the med school actually said this year, we're going to do a half-a-day wilderness scenarios to work on team building and also talk about one of the issues, sort of peer recognition of depression and anxiety, and trying to make sure you can look and take care of each other, but also spot when someone's having a problem. So that's going to be our focus for our wilderness medicine sort of afternoon. We're going to do fun things, but also get people to realize they have to be part of a team. We're going to break them down in their anatomy lab table groups, so they're going to be working through scenarios. But you can develop things like that you want to get your message across. That's really kind of the biggest part of the curriculum is, what do you need to get out of it, right? There's some basic things you need to know to cover all the whole breadth and body of wilderness medicine, and that's really well documented. But what do you need to learn so that you can function in that environment? What do you need to learn so that you can help people when you're in that environment? And how do you help the learners with you, right? So the best part of being an instructor, the best part of being faculty in one of these situations is you get to learn with them. You'll have students or residents who come in who have infinite more experience in something that you've never done. Like we're starting a fellowship. Our new fellow, he's swiftwater rescue training, which I've done that, but he's single pitch AMGA climbing guide. He's done this. He's done all these technical rescue classes. So he's teaching me how to climb. I'm like, oh, that's perfect. You can teach me how to do this, so that I'm not complete dead weight every time we go climbing. I'll still be dead weight, but but you use those resources and say, what do you want to get out of it, right? So just since we only have a few faculty, any specific questions about developing a curriculum or how you would do, what do you need to do from that standpoint?
One thing I would say is not being mental ill, get in touch with people and start something. Yeah.
So took the first step, being here. So connecting at a national meeting, as Jay is saying, that's really important because sometimes you are the only person. When you go, you're like Jay's the wilderness medicine expert at his facility. I'm kind of the de facto wilderness guy at our facility. But by bringing on a fellow, I'll get some offloading of that. Really establishing connections at meetings. So, there is the Wilderness Medical Society is out there. There's the ASEP, which has a huge wilderness medicine interest group. We have a wilderness medicine interest group here. I would encourage you to come to it and just get to know each other. And all of the faculty here will certainly share resources with you. This is one of those things that, a lot of this can be done electronically, but a lot of times it's great to just show up and be like, hey, I'm going to travel. I'm coming through. I'll be happy to come help you out. I'll be happy to come do a workshop with you for your students or with your residents. And particularly with faculty, that's going to get you an invited speaker bullet on your CV, which is perfect. They don't need to know that you conned your buddy into it. You slept on his couch, right? You were an invited speaker. Exactly. That means, yeah. I was crashing on Jay's floor until we upgraded and got another bed. It was perfect, But, those are things that you can do to kind of reach out to each other. From a medical student side, so it seems like it's hard to be like, hey, I want to do this, I want to do this. How do you find somebody at your institution that wants to do those things? So how would you do it? So that's very ineffective. I'll be honest. You get thousands of emails a day, right? So look, if you have an area of interest, look at your faculty web pages, right? And if you want to do emergency medicine, most of you are here for that. Look at all the faculty profiles. Most of them aren't updated. Most of the pictures are going to be horribly outdated. It's okay. Just laugh at us. It's totally fine. But look at those and say, hey, this person has some interest that I'm interested in, or they put wilderness medicine down, or an area that you're interested in. Send them a directed email. Swing by, call the office and say, hey, do they have office hours, or when's their next shift, and swing by and see them in the ER. Just show up. Hey, how's it going? Hey, I'm really interested in XYZ. Can we talk about it? And 9 times out of 10, when you approach someone like that, whether it's through an email or direct, they're going to be like, oh, wow, somebody's interested in something I'm interested in. Absolutely. It's not another obligation for another meeting or a mass email, need help. you know. So those are some of the things that I get students coming pretty regularly. They'll send an email, hey, can I talk to you about this? Can I talk to you about that? And you know, usually I'll say, yeah, just text me and we can set up a time, because email's horrible for me. But you know, what about you all? How do you all take it when someone approaches you? What's the easiest way for someone to get in contact with you, like at your institution? Yeah.
I've got students who usually contact me by email if they're interested in a project or getting something started. We'll set up a meeting in my office. People get the word out by, I do a wilderness medicine special topics course for students twice a year. So the word kind of gets out on the wilderness medicine interest group, which is a really big interest group at UAB.
And if you don't have an interest group, start one. Another bullet on your CV. Created the first interest group here, you know? So, I mean, those are all things that you're going to get credit for. I'm speaking primarily to the students who are wanting to get that residency spot. You have that little talk about, like, hey, I did this. This is great. Gives you a little talking point. Just make sure you did it. So any other questions about curriculum? It's kind of a real quick overview. It's hard to cover all the topics. Again, there's some, really, well done published curriculum out there, sort of guidelines for core content of what you need to know for a wilderness medicine fellowship, what you would need to cover during those things. You can look at those things and see, hey, what do I need to personally do? And, get with a mentor at your home institution or remotely. Everyone here, all the faculty here would be more than happy to help you. That's why we're here. We really like this. We really want to do this. Most of us would much rather be out doing the things we like to do than here, but we really want to make sure that we continue this specialty and that we really, give people the opportunity to get engaged and get excited about it.